in the tissue. Exotoxin. But here we can see endotoxin. Endotoxin. So when bacteria are phagocytosis or phagocytized gram-negative bacteria, after then exocytosis of endotoxins will start it, so bacteria will be killed, and the parts of the body, especially lipopolysaccharides, are released, and these lipopolysaccharides can receive to the blood and show their effect. Dead gram-negative bacteria release endotoxin, especially containing lipid A, which induces effects such as fever, inflammation, diarrhea, shock, and blood coagulation. So it has a systemic effect, general effect, and for effects of endotoxins, large number of the lipid A or LPS is needed, but a little amount, a small amount of exotoxins are active and show their activity. For showing activity, only a small amount is sufficient, but showing the effect of endotoxins, large amount of LPS is needed. So exotoxins can be effective on a specific tissue according to the bacteria and according to the name of exotoxin. So we have specific exotoxins, and those exotoxins specifically be effective on special targets and tissues, target organs. But endotoxins are the LPS parts of gram-negative bacteria, and they don't have a specific part for attack, and they have general physiological effects, especially fever. Especially they can show fever. So regarding to toxins, we have some definition, like what? One definition is toxinosis. Toxinosis. When there is a disease in a person, when there is a disease in a patient, which the disease is related to the toxin, we tell that it is a toxinosis in the patient. So the pathogenic bacteria are present in the body and their toxins are present in the body. Sometimes problem is related to the bacteria, sometimes related to the toxin of the bacteria. Okay? For example, Vibrio cholera, when they are present in our intestine, pathogenic bacteria are present and their toxins are present. But the problem which make us to go to physician and make us to go to hospital and make us to use medicine is related to the toxin. So if there is a disease in a patient related to the bacterial toxin, we tell it is toxinosis. It is a toxinosis. Toxemias. Toxemias. When one toxin can reach to blood and by blood can spread in the body, we tell that there is toxemias in the patient. Toxemias in the patient means there is bacterial toxins and spread in the body by blood. Sometimes one bacterium is in food outside the body, produce toxin. For example, there is a canned food, and the canned food containing Clostridium botulinum, and Clostridium botulinum produce toxin in the food. And if we ingest the food containing toxin, and we will be patient, we call intoxication happened. Intoxication happened. There are different types of toxins related to the different bacteria, which they are effective on gastrointestinal tract. If any toxin can act on gastrointestinal tract, we call this toxin as enterotoxin. Entero means alimentary canal. Entero means gastrointestinal tract. So the toxin which is effective on gastrointestinal tract, we call it enterotoxin. Enterotoxin. Another definition is antitoxins. Antitoxins produced by the host body and neutralized toxin. So when one bacterium is present in our body, and this bacterium is capable to produce toxin, so immune system not only produce antibody against the bacterium, but also produce antibody against the toxin. So those antibodies produced by immune system for neutralizing the toxin, we call them as antitoxins. Antitoxins. Toxoids. Toxoids. See, in some cases, we like to use vaccine. For example, when we have one pathogenic microbe, sometimes we make it weaker and use it as vaccine. Sometimes we kill a pathogen and we use the killed bacteria as the vaccine. Sometimes we use subunits of one bacterium as vaccines. But sometimes our problem is not related to the pathogen. Most problem is related to the produce toxin from pathogen. For example, in some cases, we can weak and inactivate a toxin and use it, look like a vaccine. So when we use, for example, one toxin containing two parts, A and B. So virulence is related to the A part and attachment is related to the B, and both of them are under the control of the genes. So only we use the B part. So only one part of toxin we use. The B part for attachment without A part for invasiveness. So when we use B part, there is no toxicity in the body because there is no A part. But antibodies are produced. If after many weeks or many months, the pathogenic bacteria going to the body and produce A/B toxin, in this case, antibodies are present to suppress them. So toxoids are toxins, bacterial toxins, whose toxicity has been destroyed, but still elicit an immune response. So if you change the toxin in a way that doesn't have toxicity, that have potential for activate immune system, we call it toxoid. We call it toxoid. Differential characteristics of bacterial exotoxins and endotoxins. Toxicity. We want to compare exotoxins and endotoxins. First, toxicity. Exotoxins in minute, in a small amount, are toxic. But endotoxins only in high doses can be toxic. So in a little number, a little amount, in high amount. Effect on the body. Exotoxins are specific to a cell type. For example, one toxic is effective on blood, another is effective on liver, another is effective on nerve. But endotoxins are systemic, not special for a specific part, and they have fever and inflammation. Fever and inflammation. Chemical composition. Exotoxins are polypeptide like polypeptide and are produced during the life of bacteria, but chemical composition of endotoxin is lipopolysaccharide of cell wall of gram-negative bacteria. Heat denaturation at 60 degrees centigrade Exotoxins, because they are polypeptide, they are sensitive to 60 degrees centigrade and they are unstable. That at this degree, because endotoxins are lipopolysaccharide and their structures are more stronger than polypeptides, so they are stable. Toxoid formation. Can we make them weaker and use them for interrupting the toxins? For exotoxins, it is possible. Can be converted exotoxins to toxoid, but endotoxins don't convert to toxoid. Immune response. Okay, this toxoid, a toxoid is an inactivated toxin used in vaccines. Yes, it is an inactivated toxin used in vaccine. Immune response stimulate antitoxins. So when exotoxins are produced, can induce immune system, and immune system produce antibodies, which they are antitoxins. They are antitoxins. An antitoxin is an antibody that reacts specifically with a toxin. Fever stimulation, usually not by exotoxins. By endotoxin, yes. Fever. Manner of release, secreted from live cells. Endotoxins released by cell during lysis. Typical source, some of the gram positive and some of the gram negative. But regarding to the endotoxin, all gram negative bacteria. Okay, after a pathogen can find suitable host, can find port of entry, can go inside the body, have a good attachment, then invasiveness, multiplication, spreading in the body. Some of them can go out of the body of the patient and try to find new sensitized person, sensitive person. So for any infection, 3 things needed. 1, a patient as a source of infection. 2, a transmission device. 3, a sensitive person to receive new infection. So now it is the time some bacteria wants to travel from one patient to another sensitive person. So those pathogens which live in respiratory tract, mostly they go out during inhalation, during breathing. They go out from mouth and nose, mostly during coughing and sneezing. Some of them can go out by saliva and transfer to another persons. during cough and sneezing with very small droplets of water coming out. They go and float on the air. We call them aerosols. We call them aerosols. It is, I'm writing. Why do we use masks in these days? According to the COVID-19, we use masks because with very simple coughing and sneezing, a large amount of bacteria, a large amount of virus can float on the day by aerosols. Okay, some bacteria, some microbes, some pathogens can go out of the body according to the skin. For example, injured skin after an accident, or infected skin after burning or after fire. When the skin has infection, so skin is a port of entry and as a port of exit as well. Fecal disease, so those pathogens which they live in alimentary canal, like salmonella, like shigella, brucella, and many viruses, many protozoa, many elements. So those pathogens which they live in our alimentary canal, the port of exit mostly is fecal exit. Urological tract. So most bacteria which they live as a pathogen in urological tract, and mostly they go inside and they go outside regarding sexual intercourse. Removal of blood. Another part of those bacteria which can, or those pathogenic microbes which they are present in the blood can transfer from one person to another person. Sometimes in blood transfer from one person to another person. One person is another blood donor, and the other is recipient, mostly after surgery. So in the lab, it is needed to check blood for its clearance of any pathogen. So if HIV is present in the blood, this blood is transferred to another person. Another person is infected also. Okay. Or sometimes some addict person which that they don't have money and they are not in a good situation, they use common syringe, or they transfer drugs. This addict use common syringe. So if one person has hepatitis B virus, HBV, or malaria, the others. So very easily it can be transferred from one person to another person. Or if people to go to the places for hair cutting, and the person is using the shapes, razor blades, common razor blades for shaving face or neck or the other parts. If one person is infected, so the other person can be infected also during, because sometimes shaving is not safe and cut. A little cut is sufficient to transfer the microbe to the other person. And sometimes some people going and request to do some shapes on their skin by some shapes on their body, on their hands, on their foot, and the other things. So with this equipment, easily infectious disease in the blood can be transferred from one person to another person. So any part of the body which is the source of infection can be the source of disease also. Okay. How are the disease reported from and reporters? For example, one person is in the has problem and has burning, skin burning. So Pseudomonas is present on the skin. If in any case, if it's bacterial in blood and without examination, transfer the blood of person to another person. So, but mostly the port of entry mostly is the port of exit also. When person with infection in the ear, so infection come to ear and can go out from the ear by hand, by air, or by the other things. Broken skin, skin flakes, eyes, tears, nose, secretion, mouth. For example, one person has catch cold. So there are many secretions coming out by the nose. And it is very easily can go directly or indirectly or by air to the nose of the other person. Mouth, saliva, sputum, in females, mammary glands, milk, secretions, and urethra, and the other things. Mucous membrane, like when there are a large number of sputum coming through the mucous membrane come out, and there is mucus on the nose, and when there are pathogens on the nose, they are coming from mucus, then going to the secretion, and then going out. So they can reach outside. Establishment of infection and disease. There are some definitions. First definition is incubation period. Incubation period. What is that? It is the time between entry of the microbe and symptom appearance. For example, if now you eat a contaminated food, immediately you don't have pain. Immediately you don't have problem. Immediately you don't go to the physician. Sometimes it is after many hours, sometimes it is after many days, sometimes it is after many weeks. It is dependent on the type of bacteria, okay? According to the type of bacteria. So the time between entry of the microbe and symptom appearance, it is incubation period. The second definition is prodromal phase 1. Prodromal phase 1. When problem is started, it is mild. The time of mild signs and symptoms. So first symptoms and signs are very mild. Then slowly you go to the next round as acme period or climax. Signs and symptoms are most intense. So you have the maximum problem in this part. Then period of this line. As signs and symptoms subside and slowly there is reduction in the problem. Period of convalescence, body system returns to normal. Now we can see this photo. So it is entrance of, for example, measles virus into a child, from one person to another, one child to another child. First, it is incubation period. From 0 to 10 days, it is incubation period. So the new person received the infection and have the infection, but cannot understand. She doesn't know. She has problem. Between 10 to 13 days, prodromal phase. She has problem, but it is not so. Between 13 days to 16 days, rash appears at hairline and on the face. And she cannot go outside. She feels very bad and she stay at home. In the days between 16 to 18, it is period of this line. Period of this line. Slowly, the problems will decrease. And in the 18 to 20 days, period of convalescence. Rash fades from the body and she can go out and do normal things as before. So incubation period, prodromal phase, acme period, period of this line, period of convalescence. Patterns of infection. Sometimes we have localized infection. So infection remains confined to a specific tissue. For example, only intestine has problem, or only liver has problem, or okay, it is localized to only one tissue. Second one is focal infection. Focal infection. When infectious agent breaks loose from a local infection and carried to other tissues. So if only one tissue, it is localized. If it can go to the neighbor tissue, it is focal infection. And if it can reach to blood and can go to the different parts, it is systemic infection. 1 second, please. Excuse me. So systemic infection. Infection spreads to several sites and tissue fluids, usually in the bloodstream. What can we see over here? So it is localized infection like boil, okay? Only one part. For example, lymphatic glands. And systemic infection, when whole body microbe can go through blood to the whole different parts of tissues and organs. Focal infection. For example, here, lung is infected and infected going to the heart. But if they go afterwards to blood, so again, it can be systemic. So local, focal, and after that, systemic. Mixed infection. What is the mixed infection? Sometimes the causative agent of the disease is only one pathogen. Sometimes the causative agent of a disease is only one pathogen. But in some cases, maybe two or several pathogens are the causative of the disease. Here you can see different various microbes are the causative agents for the disease. Sometimes one disease started by one pathogen. So the pathogen start the disease we call primary infection, like in urinary tract, yes? So when one microbe start the problem, it is primary infection. But sometimes after primary infection, one or another pathogens can add to the disease, to the infection, to the problem. So the next one is secondary infection. Primary infection, secondary infection. Supposing, for example, there is one pathogen, for example, one amoeba, like Entamoeba histolytica, in the intestine. Like what? For example, Entamoeba histolytica. You know, it is a pathogen and it has invasiveness. It attacks to the intestine with bleeding. So in the intestine is full of different bacteria, which they are normal flora. But those bacteria in the intestine, they are normal flora. If there is a gap, if there is a port of entry to blood, if there is a port of entry for the sterile part of the body, these normal flora change their appearance from normal flora to the pathogen. And because they come after the previous infection, we call them secondary bacterial infections. Secondary bacterial infection. Okay? Or, for example, what is this? Leishmania tropica. What is this causative agent for? Correct? You know, this disease is on the skin of the face or hand or foot, mostly skin of the face. So Leishmania tropica is the causative agent for primary infection. But after infection will be started, okay? Yes. Boil, Delhi, Baghdad, love causes, yes, of course. Lahore boil, and many names, because it is very common in the Asia, mostly in your place, in Iran, in Pakistan, in many cases. And you know the reservoir is dog. So in places which there are more dogs with sandfly, so its prevalence is more. And where dogs are less and sandfly are less, so prevalence is low. For example, if you see one city, we can see cases in the middle lower than the cases around the city, because around the city there are many souls, many sandfly, many dogs. Mostly it is related to the dog. Okay, it is related mostly to dog. Okay, so this disease agent, original agent is Leishmania tropica. But after infection start, situation is proper for normal flora to start infection also. So it is secondary bacterial infection. Secondary bacterial infection. So we have primary infection and secondary infection in some cases. I explained that in some cases there are mixed infections. So two or more microbes are responsible in one infection of and disease. Several microbes grow simultaneously at the infection site. Primary infection, initial infection. Yes, it is related to the pathogen start the infection. The pathogen start the infection is responsible for primary infection. If one infection is present and continued with another pathogens, it is secondary infection. Secondary infection. Another infection may be by a different microbe. Okay, so it is sufficient. We are on the page 30. So happy Eid. Have a good time, inshallah. And we will continue next week our lecture. Please remind me, we should start page 30. If there is any question, you can ask me. If not, we can finish the lecture. Is it any question? Okay. Okay. I am new student. I want the lecture. Okay. You can use my mobile number. Send your message to my WhatsApp as you want. I send you. Okay. My number is okay. This is my number. Send WhatsApp in my PV. So I'll do whatever needed. Okay, thank you very much. Hope the best. Happy Eid.